Thank you, John. So like John said, I'm going to be talking about geographic barriers and access to health care. First, I'll just let you know what I'm going to go through. I'll give you a little background on the VA and some of the problems that they're having. Talk about my data, where I got it from, and what exactly it is. And then my study area, how I found it, and what I did for an analysis. And then the results of my analysis and my conclusions and what I learned. So everybody here has probably heard at least one horror story about the VA. Whether it's a friend, a coworker, the news, or you just saw something on Facebook. And we hear these things so often, it really sounds like the VA is getting worse and worse and worse every year. But that's actually not the case. The VA has drastically improved. So what is the problem? Well, there's funding issues, and they also, in 2002 when we went to war, we were supposed to go in, out, and that was it. That didn't happen. We're still there. And so what has happened is that the number of patients at the VA has actually increased by 30% since 2002. And that's actually quite a bit of difference, especially when the funding is not keeping up with that. The other issue is that veterans are returning, they're surviving injuries that they never would have before in previous conflicts. And this is actually really good as far as a problem to have, but they're not able to keep up with the influx. An example, this is Lance Corporal Kyle Carpenter, a United States Marine. In 2010, when he was in Afghanistan, a grenade came between him and his fellow Marine. And in order to save his fellow Marine, he threw himself at the grenade. So 4 years and 40 surgeries later, he became the youngest living recipient of the Medal of Honor. And this is a huge thing to survive. All right, in the VA, it's also not just taking care of veterans from this conflict. The Gulf War era, I'm including everybody from the first Gulf War in the 90s through now. But they've also got Vietnam era veterans, Korean War, World War II, and peacetime veterans. So why would peacetime veterans need VA care? Well, you're actually more likely to be injured or killed during training. It's because you train more than you fight. That's the goal, hopefully. And now, why do we need to make sure that veterans are getting this care and getting it on time? Well, if we take a look, especially with mental health, suicides per 100,000, veterans are outpacing their civilian counterpart at a rate almost double. And while the military wants to excel and be number one, this is not an area where we want to do that in. So what are the current problems? Well, we have extensive waiting periods for appointments right now. And this is after they've waited to get their benefits. When you get out of the military, you get about 6 months of insurance. And that's supposed to tide you over till you get your VA benefits. However, depending on what your injuries were, where you got out, and where you applied for your benefits, sometimes it's taking up to 2 years. And then when you get those benefits, having an extended waiting period, that's a lot of time where you're not getting taken care of. We also have problems with distance to facilities. VA hospitals tend to be located in major metropolitan areas, a lot of times attached to a university that has a medical school or a nursing school. This benefits both parties. But veterans living in rural areas are having difficulties getting there. Specialists not being available. The people that live further out, they have community-based outreach clinics, but these tend to have, a primary care provider, maybe 1 or 2 mental health specialists. What you're not going to find is your oncologist, your cardiologist, your geriatrics. It's just not there, so you have to come into the hospital for that. So in 2014, the VA enacted the Veterans Choice Program. And what this does is allow certain veterans to gain permission to be seen outside the VA. Some of these veterans, if you have a waiting period of over 30 days to see a doctor, you can call and possibly get permission. Veterans living more than 40 miles driving distance from the VA facility that they need to be at, they can also possibly get permission. And then if you have an excessive travel burden, right now these are being described as a medical condition. Say you have something wrong with you where you just can't drive that far. That's taken into consideration. And geographic challenges. And these are usually if you've got to take a boat or a plane to get to the hospital, or maybe there's a mountain in your way. And the plane or boat is kind of iffy because if you're in the American Samoas or Guam, none of this applies to you. They don't take into consideration is excessive traffic or excessive travel time, only distance. And this is what I am going to be covering. So my data, I got most of my data from the US Census Bureau, the California Department of Transportation's NAVTech maps through business analysts from Esri, and the US Department of Veterans Affairs. All right, so my study area was in California, and I'm going to give you guys a few numbers right now and how I got them. About 42% of current veterans are enrolled in the VA healthcare system. And at any given point, 6% of the total number of patients are civilians. And this is because surviving spouses and dependents of service members killed while on active duty are entitled to VA benefits. So California has 2 million veterans, approximately. That gives us 840,000 veterans enrolled in the California VA system. And our 6% civilian would be about 60,000. So this gives us about 1 million patients being seen and at one of these 8 hospitals. We have 8 hospitals, and there's one surgical center up in the Palo Alto Menlo Park area. This gives us about 125,000 patients per hospital. If we look at the civilian counterparts here, we have 38 million residents in California, and I'm removing the 1 million veterans that are being seen at the VA here. We have 437 hospitals. So this averages out to about 87,000 people, and this is 30% lower than the load the VA is taking on right now. Okay, so to actually find my study area, I needed to find out where most of the people in California lived. A lot of people forget that most of California is agricultural. So we got no big surprise here. We got San Francisco, LA, and the San Diego area. So I needed to find out if any of these major bottlenecks fell in that area. Yeah, exactly on top of these locations. And I analyzed San Francisco, LA, and San Diego for my paper. However, for this presentation, we're only going to be going over the LA area. All right, so this area here, we have the hospitals in Long Beach and Los Angeles, and this area is the 40-mile driving distance around. Now, we're going to have to make a few assumptions for this because veteran data, like addresses, they don't just give that to anybody. So we're going to assume that the veteran population is distributed in the same way our civilian population is. So this area has 32% of California's population. Now, so if the veteran population is the same, that gives us roughly 600,000 people. And at 42%, that's 250,000 people being treated at one of these 2 hospitals. So like I said, veterans' addresses are just not readily available to people. So in order to analyze this, I chose random points throughout the area to represent the majority of the geographic locations. And then I had to find the closest route, the shortest route to the hospitals. All right, then after that, I'm going to lay the bottlenecks on top. If you see here, all these dots, each one is a data collection point. The Department of Transportation in California has points where they count every single car that goes over it every day. And then at the end of the year, they total them all up, divide it by 365, and that gives us our average annual daily traffic, which is how many cars go over it a day. And if you look, there's a lot of red. And that red means there's at least 150,000 cars going over that every single day. Now, yay, chart, numbers, boring. But if you look here, this first point that I had chosen, this church, it's about 11.7 miles from the closest VA. No big deal. And it's about 20 20-minute drive time, which is pretty decent. However, if we hit peak traffic, we're going to get a delay of about an hour, which gives us almost an hour and a half drive time to go 12 miles. Now, I thought that, even for LA, that had to be excessive. So I went back through the data. I took a look to see if something was wrong with the data. Maybe I had added something in there. I couldn't find anything wrong with it. So when all else fails, we go to Google. Now, Google they put in the same exact locations. They made sure the routes were the same. And we've got here 11.7 miles. And Google has it at an hour and 15 minutes. It's about 10 minutes less. However, this route and this data, that's from like a week and a half ago. The bottlenecks were from 2012. So there could be a bit of a difference. But an hour and 15 minutes is still pretty long to go 12 miles. We could cut it down, maybe 5. It's an hour and 10 minutes, but that's still pretty long. Okay. So I decided to see if veterans were able to go to the nearest civilian hospital, how would that look? So you can see here, the routes are they look pretty short, and some of these, they look like they're right on top of each other. Now, if I were to zoom in, you would see that there is a route. They're not like right next door. Well, some of them are actually kind of right next door. But now, if I want to see if there's any of the bottlenecks fall on these areas, there's not too many. We have a handful right up here. I've got some red, but it's only a couple, so that wouldn't be that bad. And most of these are just very short drives. So what do we have here? We've got there we go. All right, so we've got our original 12-mile drive at an hour and a half. Now, if we go to a civilian hospital, it's 2 miles, 4 minutes, and that's even in heavy traffic. And if you take a look at the rest of these, 15 and a half miles, heavy traffic, that's a little over an hour and a half here. 35 miles, we're pushing 3 hours for some of these. Now, I live 26 miles from the VA, and I can get there in about 35 minutes, 40 if I hit every red light. But Tucson, we're situated a little different, and we don't have LA traffic. All right, so my conclusions. What did I learn from this? Well, first, I'm not moving to LA. Second, that bottlenecks may in fact cause an excessive travel burden. And this is problematic because if people are having a hard time getting their appointments, they're just not going to go. And veterans that are being considered for access to the Veterans Choice Program, traffic should be taken into consideration if they live in one of these areas where this is a problem. And lastly, I would recommend further research into this. I only looked at 3 areas in California. Now, I got very similar results at each point. But all that really tells me is that there's really bad traffic in California, and that veterans in these areas are probably having difficulty. It doesn't tell me if it's a problem widespread throughout the United States. So I would recommend looking into other major metropolitan areas to see if this is actually an issue. And possibly extending the research to find out if this is a problem with civilians as well. Because you can't just go, nobody can just go to any hospital they want. Everyone is limited by their insurance provider. So there may be some additional problems there to look at. Okay, does anyone have any questions?